So as we start, I'll just take a moment and invite you all to bring yourself into this space and invite you to join me as I acknowledge the ongoing and traditional custodians of the lands that we meet on this land we now call Australia. And where I put my feet on the ground, that's the Whadjuk people of the Noongar Nation. And I'd like to pay my respects to elders past, present and into the future, and acknowledge that as an organisation that was set up 30 years ago, Health Consumers Council was set up to provide a voice for the community on all aspects of health. And so as an organisation, we are proactively thinking about what it means for us as an organisation after the Voice referendum to be an organisation that stands up for all people, but particularly Aboriginal people, to have a say on the issues that affect them, including health. And so that's very much a live issue for us, and it's very much a work in progress. But I'd like to acknowledge that this always was and always will be Aboriginal land. A number of you I know have joined us on these COVID community updates that we've held since the early days of 2020. But I am delighted to be joined today by Dr. Andrew Miller. Andrew, I think for many of you may not need much introduction, but by way of a brief introduction, I'll say that he will be known to many of you as the former president of the WA branch of the Australian Medical Association. He is the chair of OzSage, which is a multidisciplinary group of experts that many of us, I think, turn to for that kind of voice of reason, and also a columnist for the West Australian. And I know that many of us in the community have valued your willingness, Andrew, to say the things that need to be said. And so we are absolutely delighted to have you here with us today. And the way today is going to work is that I've invited Andrew just to give us your take, Andrew, on where we are up to at the moment with COVID, both in WA and Australia. And then we've got a few questions that people have submitted that are still present for people about what it means to be living with COVID. So Andrew, over to you.
Thanks very much, and I'd like to reiterate my respect for the Whadjuk people of the Noongar Nation, the land on which I am today, and welcome you all to this this chat, which I hope will be very much a multi-way conversation. And I appreciate your interest in the topic because I guess by way of where are we at from the point of view of the pandemic, well, we're exactly where you might expect a human population with all its fallibility might be in response to an unprecedented existential threat which faced all of us together. A classless threat, in fact, initially before vaccine, because it was unclear that we would ever successfully be able to control the severe nature of the disease and its seemingly random effect on the individual. It was quite unclear and remains to a degree unclear why it is that certain previously well individuals do very badly with this disease when unvaccinated, and why some people, even very elderly, frail people, seem to handle it without too much drama. So it's an unprecedented thing, and it's not surprising at all that the community has not coped well. No one has ever said, we have an urgent, pressing problem. Somebody please call the government to come and sort this out. We are just not equipped in our society with the type of conversations that we have in the public space to deal with the failure of 2 football teams in one season from our city, let alone to deal with a major additional cause of infectious disease and death in our community, and what that means for our elderly people who are already, as we know from the Royal Commission into residential aged care, being treated abysmally in many ways. And then, so it's no surprise to me that we're now in a phase of denial. Policy is very slow to formulate and to respond to things, and there are fortune favours the status quo when it comes to policy. As you all know, if you're in the advocacy space, once something is decided, people would rather go along with whatever's in place than try to change it, because changing things always involves somebody losing something that they want to hold on to. So there will be somebody who will protect the status quo no matter how preposterous it is. So we are waiting to see the overwhelming evidence around long COVID, which is really the bigger health problem than the acute severe disease for most people now. We are waiting to see when that evidence will be accepted, and that will take a shift in the paradigm that medicine has, which never copes very well with a brand new problem or an unusual problem, one that doesn't fit well with the standard thing that doctors like to have. Doctors are exactly like politicians. We like you to come in with an obvious problem, which is something that we have a solution for that hopefully works very quickly. So politicians like to build things because we can all see that happen in front of our eyes, and they can point to it and wear a hard hat and get their hand shaken for making a stadium. And doctors like a problem that we can prescribe a drug for or do an operation for and thereby solve it. And people who don't fit into those categories as patients often find that they need to end up finding advocates for their healthcare journey who will understand that they're coming to the medical profession with something that doesn't easily fit into the existing paradigms. And so we've got this whole new paradigm around long COVID now, around its contribution to cardiovascular and neurological disease, to endocrine disease like diabetes. And we're seeing excess of all of those things, excess morbidity and mortality from those things continues. That data's really quite clear. What is unclear is what we are going to do in terms of bringing in any sort of mitigation, by which I mean ensuring we have a robust vaccination response and that we focus on clean air and the protection of people who have a right to access public spaces by having mandated safety from other people's infectious disease when they're in those places. And of course, this would have a flow-on effect to things like influenza, which we're having a little panic about at the moment, but it's very small in comparison to the disease that must not be named by politicians at the moment, according to their public affairs people. They get very poor response when they mention COVID. It's all a bit traumatic for a lot of people, not because we had the deaths in Australia that we saw overseas because we had our borders closed, but because people regard it as a negative, and so it's not making its way into the public policy space. But I suspect I'm preaching to the choir in that regard. If you're people who are interested in healthcare consumers and those who get the rough end of the deal perpetually, getting the rough end of the deal right now. And that's what we at OzSage and those of us who are in this space, the ragtag bag of misfits that keep carrying on wherever we can, that's what we're interested in changing over time. So I can probably leave my comments there and see which threads you would like to pursue in terms of who is the most spectacularly annoying or incompetent amongst policymakers.
Well, we only have until 2 o'clock, so
yeah.
I can imagine that there'll be a number of diverse views on that. Look, you mentioned before about people in aged care. So I guess just one thing I wanted to pick up on, because I had reason to look again on Friday at aged care vaccination rates, COVID vaccination rates. And I did actually follow this up with both the state and the federal, both the Departments of Health and the ministers. So WA has one of the lowest levels of COVID vaccination rates in the country. And while the response from both levels of government seems to be that they are trying, it's clear that it's not yet having an effect that we might want to see. And again, vaccination being one of the strongest protections, I guess I'm interested if you have any reflections on that particular challenge. People on this call may have family in these facilities, or there might be other people in their community who are perhaps more vulnerable, but might be, because the information I've had, it's been suggested to me that, people are resistant to vaccines now. And actually, we're trying, but it's not, we can't force people to get vaccinated. Do you have any reflections on that? You just unmute.
There we go. Sorry, I can't unmute myself, which is most frustrating position for a middle-aged white man to be in, because we like to talk over the top of everybody. And that's probably a good point at which me to say, if I say anything that offends anyone, I'm sorry. I tend to be a bit superficial and offhanded at times with making sarcastic comments. So I hope nobody takes me too literally. Look, vaccination's an incredibly frustrating space because of the vacuum that's been created with the lack of full-bodied enthusiasm by our government for a robust vaccination program for all ages. And because that's then been filled by an anti-vax sentiment, and it's been, I suppose, co-opted by people who are libertarian and anti any sort of government intervention telling people what to do, and this idea that we're now going to be personally responsible for public health, which of course is an oxymoron and an impossibility. So I blame the vaccine authorities for not being stronger on insisting on a rigorous and evidence-based vaccination program in Australia. And I think that the transparency and the decisions of the US in this regard, whilst their CDC has been found lacking and politically has been bullied around at various times, their vaccine program has been a success. And I think that we need to, as advocates, be asking what is the case for abandoning the approach of what seems to be a very transparent and well thought out public vaccination policy in places like the US, Canada, most countries in Asia, even countries like Cuba and the South American countries, very pro-vaccine and very keen on boosters for all age groups from 6 months and on. We have the ATAGI committee, who for one reason or another seem to be following more the JCVI in the UK. And I've heard reports of the health minister federally this week saying that we're relying on hybrid immunity. Now, there are experts who I trust, such as Professor Raina McIntyre, who is on the WHO vaccine advisory group, so at a more international level than ours, who are adamant that hybrid immunity cannot occur for this disease, partly because we don't have a sterilizing vaccine, one that prevents transmission of the disease. And partly because there's large segments of our population going unvaccinated, and hybrid immunity only occurs in vaccinated populations. It refers to having a vast majority of people vaccinated, as we do for measles, and then a small number of people who either can't be vaccinated or won't be vaccinated then get the protection of a hybrid immunity if they don't die from the disease. Now, with measles, you get it once and you tend to have a lifetime immunity for it if you survive, which most people still do. But in regard to COVID, of course, we don't develop ongoing immunity from an infection. So really the idea that we'll get hybrid immunity with the current range of vaccines is just not going to work. We need to be getting primary courses and boosters, seems to be, to me, and OzSage's point of view is that is the best way of doing it. That's certainly what the Americans think. So, it's not like we're out there on our own here with a strange idea. It's certainly what the Canadians think. And we hope that the risk of long COVID will start to become more influential on the thinking of local vaccination decisions, because it seems to me at the moment, most of the decisions are justified by saying that the acute and severe disease is not as bad in certain groups, so they don't need to be vaccinated. Now, if it's true that they have withdrawn the primary course of vaccination from children, which is being reported this week, it's waiting for clarification on that. But if that's true, then I think that as a nation we will come to regret that decision of leaving our youngest people, particularly infants 6 months to 2 years, who seem to get a significant rate of bad problems with this disease. And as it's still evolving and as we're still learning more and more about particularly, things like cognitive effects, and I think that the precautionary principle would tend to push us in the direction that the US has gone in, rather than the course that Australia has chosen at the moment. And I'm afraid if my best advice to people is book a trip to Hawaii and go to a CVS pharmacy to get your vaccine, then I think that we really need to keep asking questions loud and clear of our government.
Mm. So to stay with vaccinations for a moment then, so could I just check, insofar as you're able to comment, the rationale for not offering the vaccine to everyone in Australia, do you have a sense of why that is? I mean, if you read the kind of popular commentary around vaccination, it's certainly, if you read social media all the time, you'd think that there are a number of people who have concerns about the vaccines. Is there any safety concerns about the vaccines that might be driving that decision about not making it available? Or are you able to comment on that?
Well, I think that the public reasoning is that the vaccines are very safe. They've obviously been given to billions of people now, and they have a very, very good safety record. And although there are people who do get adverse effects from vaccine, on balance, overall, those on a societal level, whilst they're incredibly devastating for some people who do get an adverse vaccine response, on an overall level, it's much less than the impact of the disease would be unchecked. The argument that I see is that if we only take into account acute and severe disease, in children, for example, they don't tend to get a lot of acute and severe disease, therefore the risk of the vaccine is not worth taking. And it then becomes a judgment call, and that judgment to some degree will be influenced by the fact that if you give someone a medication and they get a problem, then they will sheet that home to you. Whereas if you tell people they don't need the medication and they later get a problem, well, that can be blamed on the disease rather than the person who gave them an injection. But if you take into account long COVID and the increasing evidence that vaccination helps to protect everybody from that, then you would go in the direction of the US. So that's my judgment, is that this is partly, and it then becomes, to a degree, when you criticize these decisions, unfortunately, it then becomes people with entrenched positions, philosophical view, and people who then start to say, well, long COVID is in the mind of the beholder. And unfortunately, people with things like chronic fatigue syndrome and ME and so forth are very familiar then with the dismissal that comes along with, well, I can't see your pain, I can't measure your pain, therefore your pain is not important. And there's mounting evidence that long COVID, of course, is causing all sorts of problems that may be helped by vaccination. So if you want people to take personal responsibility for their health, I don't see the problem with making the vaccines available to those who want them. If we are going to say, look, it's entirely optional whether you wear a mask in a public space, then surely people who feel that they're more vulnerable and would prefer the protection of a vaccine should be able to access that vaccine. But we have a practical ban in this country, which would involve international travel to get hold of it. And I just don't think that's an equitable outcome, nor is it equitable that only the rich can afford to travel to be vaccinated if that's what they want to do.
Yeah. Yeah, and look, we'll come back to that issue of cost too, because I think another area that we're seeing that play out is access to antivirals, either for people who may in fact want to travel for reasons of family or leisure, but also even just being able to, know how to access them quickly if they don't fit into a particular category. To stay then with long COVID briefly, we're going to come to some of the other, I can see the questions coming through in the chat and we will come to those in a sec, but you talked about long COVID and about that we're waiting to see the overwhelming evidence about it. I wonder if you can say just a little bit more about what we do know so far, and particularly perhaps if we're starting to learn anything about the impact of multiple infections.
Yes, there's very good research about the persistent effects of long COVID increasing after subsequent infections, unfortunately, and the things like brain fog, cognitive issues, heart issues or dysautonomia, so things like tachycardia, and then being unable to mount a good blood pressure response when you stand up, so getting dizziness and so on. then issues like diabetes, so contribution to diabetes and also to dementia are things that have been documented actually fairly early in the pandemic, which means that the effect is reasonably easy to pick out of all of these things increasing. Now, this is not surprising when we look at the basic science. So the work of someone like Jeremy Nicholson, Professor Nicholson, who we are lucky to have at the Phenomics Centre in Perth, who has been saying since very early in the pandemic that the biochemical response, the biological response that we see when you do basic research on the hundreds of proteins that we find in our blood is that this is a very different disease to influenza, which in itself can wreak a whole lot of post-pandemic problems. So we know that in influenza less commonly caused issues with people neurologically, and the big increase in Parkinson's disease following the Spanish flu is well documented. So there's good basic science reasons to be concerned about it. There's good evidence coming in order to be concerned about it. And I don't think anyone would say that who's serious about the science and doesn't have a political or other conflict of interest that they're trying to drive. I don't think anyone would say that getting repeated COVID infections is good for anybody's health. It's clearly not. So that's not in contest. The question is, what do we do about it? And there are some who say, well, there's nothing much we can do about it, so you just have to cop it. And then there's others who say, well, you guys just want lockdowns all the time. We're not going back to lockdowns. Well, you know, apart from the fact that Western Australia had travel bans interstate, we had very little in the way of lockdowns anyway. But that's not what we're asking for. What we're asking for is for people to be treated with some equity, and for particularly vulnerable people to have safe public spaces, safe healthcare, and access to antivirals and access to vaccines. So antivirals is a good point. They're very expensive. In the US, they're, I think, only now starting to make it more difficult for people to access them, but they've certainly been pretty open slather there as far as just getting a script and going and getting them at a pretty cheap price. And hopefully the price of those will come down as time goes by, because they certainly have been shown to reduce not only the acute problems, but also the longer term problems. Right. So it's just, we're just fishtailing down the road at the moment. We've gone from this sort of position where everybody did respond early on, although some were reluctant, to then a very enthusiastic opening up and abandoning of all protection so that you can walk onto an oncology ward now in Perth, and you'll find that there are unmasked staff members there, despite the fact that there are people with very low white cell counts. And I think the legal system is also very slow, along with the policy system, but eventually we'll start to see people suing because of this. You know, you don't have a lot of energy to sue when you've got leukemia and no white cells, but you know, that will happen eventually, and then the boom will swing around and people will have to do the right thing. And unfortunately, in very busy workplaces, people will only do what is required of them to be done because they're too busy to be doing extra stuff. And so unless this is part of the rules, unless it comes from the health department on down, then it just isn't going to happen through, you know, people being exhorted to do the right thing.
Yeah. And look, we'll come back later. I think we might kind of round off with a bit of a kind of advocacy checklist, if you like, for things that people can do. So you've seen that there's a couple of comments there in the chat, and you have spoken both today and at other times about the inequitable nature of the lack of protections and the effect that has on people. I know we've had one comment, for example, about the cost of rats being so prohibitive. I mean, I think at the moment they're maybe $10 a test, and that makes it unaffordable, and therefore people aren't checking, and therefore people don't know whether or not they're infectious. They might be going about their business, their daily lives, and that people, particularly who are at greater risk, who might be immunocompromised, might be at greater risk of severe disease, have become, their quality of life has become significantly impacted by the lack of protections in the community. And certainly we've had conversations in our office about at what point does this get classified as having, you know, it's impacting, it's disabling people in terms of people. We've had comments sometimes for these events, people haven't been leaving their house other than for essential medical appointments. So one of the comments is it's bad enough living in a society with few restrictions, but to then also make tests so unaffordable, it's actually very difficult for those who are trying to protect themselves to be able to check their own health on a regular basis. Is there any comment that you've got about that?
Well, I think it's outrageous, and I think that we're forgetting the human aspect of a lot of this. And I'd like to just pause and pay respect to people like Anne Lawless, who's put in the comment about her own family there, and give my condolence as well. I think that it's a strange thing that Australia has been so successful in the first couple of years of the pandemic. So there's no big community awareness really of what was avoided, probably the 60 to 70,000 lives that were saved. And there's no acknowledgement of the people that were lost. There's no COVID national memorial. There's been no day of mourning or recognition or paying of respects as a community. And I think that's all political. It's all business driven. And I think that the constant daily casting aside of the concerns of people who are vulnerable to this is simply, unfortunately, rubbing people's noses in the fact that the society really is a bit of a winner takes all game. Now, unfortunately, a winner takes all game doesn't work for the winners either in the long run, because this idea that there's a healthy group and a sick group is just not true, because we all become elderly, we all become disabled unless something else happens to us along the way. And we're all very close to somebody who will. So we're all in this together. And it's really just a bit of a teenage response that our society is having of being in denial at the moment. And so I think if we can possibly just keep talking about safe access to healthcare, and supplement that with good guidelines, like the type of statements that OzSage tries to put out, which are based on expert evidence and which kind of have some credibility in terms of being quoted to people. And pushing clean air, as Anne quite rightly says there in the chat, is that air quality is a public health issue. Water quality is. If you go to places like Belgium at the moment, they will have the restaurants need to show a CO2 monitor outside the door showing what the level is inside a restaurant before, so people can decide for themselves whether to go in there. The reason they're doing that is because a lot of people died in those places. And so this is more real to them. If you're in New York, no one jokes about COVID. No one jokes. Well, some people might, but most people don't. Most people know someone who died or have a family member who died, and they're in northern Italy. No one thinks that this is okay just to have a bit of a half-baked booster program, which isn't really being treated as seriously as the road toll, which is killing less than 1/10 of the people that COVID still is in this country. So I think, unfortunately, this is also mirroring things like the AIDS pandemic, where it took years of advocacy before government would take seriously the need for proper medications and proper response. And again, the same kind of vulnerable people in the community are the ones who lose out, and we can only continue to beat the drum where we can and get the message out. And if nothing else, it puts it on the record, so that people can't say, well, no one ever told us that we needed clean air in public buildings. No one ever told us people were missing out on healthcare because they felt unsafe going to their oncologist appointment. And those, those laws are there, but they just take a long time to get those policy changes in place. In sort of reflecting on the comments around the AIDS crisis in the chat there, one of my inspirations long before this ever happened was David Kramer in the US, who started the ACT UP movement and used to go to meetings when Fauci was the head of the CDC and refused to sit down during the meetings because he said he wouldn't sit down with murderers. And I think that it's this being told that we have to be polite, being told that we have to be quiet and sit in our corner is a way of bullying us into silence. And so we just have to push back against that and act up in whatever way we can to keep getting the message out there. And I think that it's, in terms of practical things like accessing rats at the moment, it is difficult. And if we keep the message in front of politicians that that's what we need, then hopefully we will see some turnaround in time.
Thanks, Andrew. Those are really powerful words. And I know recently I had reason to watch, there's a movie about the AIDS movement called How to Survive a plague, which is both very moving but also very inspiring in terms of the relentless action and the fact that yes, it took years, but it resulted in real change. And it also, as I understand it, changed some protocols in terms of being able to accelerate, for example, access to some of the medications in a way that hadn't been considered before because of processes. And I acknowledge that what you're saying is that for many people who are impacted, say for example by long COVID, that they are in fact the symptoms of their condition is in fact that they are, have less energy or are often exhausted by just trying to navigate day-to-day life, particularly in an environment that's maybe not as hospitable. And so, yes, as an advocacy organisation, we're thinking about what that means for us and how we can create, more opportunities to have more visibility of this issue. So on that question around people's own, if you like, you've talked about advocacy, and if we think about both things that people can do on an individual basis for themselves, as well as then perhaps on a more organised basis collectively. One of the things that people certainly commented to us was a positive move was when there was a requirement again for staff to be wearing respirators or masks in clinical settings, a requirement in high-risk clinical settings and a recommendation in others. But the reality has been that many people have reported to us that they're not seeing that. And in fact, even people who know they're at high risk, when they have asked for clinicians to wear a mask, it's been rejected or refused. One of the questions is from Michelle, is how can we get through to the public health sector that the removal of COVID protection, such as masks in healthcare, has been a disaster? And how might is there any particular advice you have for an individual who might find themselves in a setting where they would like for masks to be worn around them or respirators to be worn around them? Any magic words, Andrew, that might be able to get them to access that?
Look, I wish I had magic words for all range of people who are essentially whistleblowers and asking organisations or individuals within organisations to do the right thing, because history doesn't treat whistleblowers very well. All right. So whether it's in regard to sexual harassment or people not complying with their own guidelines in wearing masks in clinical situations, people are concerned about bringing things forward because they're worried that it may in some way impact their relationship with the people who are supposed to be providing their care.
Yeah.
And history is littered with examples of people who've tried to ask people to do the right thing, and it's really been a very traumatic experience for them. So I'm sympathetic to the idea that you have to you can only do what you can do, and if you don't feel that you have the strength to stand up to the people who are supposed to be looking after you in those circumstances, then the individual risk on a particular individual occasion can be reduced by masking yourself, and one-way masking is way more effective than no mask at all. If you want to be kind of polite and subtle about it, i.e. not like me, then you can carry with you a copy of the Australian Commission for Safety and Quality in Healthcare's Charter of Patient Rights. And you can even have a little blurb written down to say that I've been told that it's my right to not only be safe, but to feel safe in a healthcare facility when I'm being treated. And respectfully, to me, with my immune system, part of feeling safe would be if the people would agree to wear a mask when around me, and to consider the quality of the air that I'm breathing. So a simple card like that or something is influential. I think these organisations do respond to complaints, and they don't have to be nasty complaints. They can just be a suggestion for improvement. Could I please have a response in writing as to why it is that, with COVID levels still being relatively high in the community, and unfortunately the only way we can really measure them at the moment is from aged care statistics, because they still have to collect them there and in wastewater, but with it still being a significant disease, and with we know that the vaccines aren't necessarily 100% protective for people with immune problems. With that still being around, then, you know, I would just like it recorded that I was treated on these occasions without what I would consider to be fairly easy mitigations in place. So that'd be one way of stepping around, let people know in advance what your requests are. And I think that those are very reasonable things. But look, you know, I wouldn't go into onto a work site and start arguing with the foreman. It's a tough thing. It's a big power gradient to go into a hospital and start telling the nurse who's checking you in. So aside from having a little something written down, I think if you um, if you sort of find it too difficult, at least, you know, take your own precaution with your mask and be reassured that hospitals do have excellent mechanical ventilation systems. So in most circumstances, they are getting pretty reasonable air changes per hour in the rooms. And so it's not necessarily going to be a super negative situation for you. And I think we do need to whilst driving for improvement of the system, we do need to provide some reassurance to people that if you're taking your own measures, it's probably in many cases more dangerous to miss out on your treatment than it is to go there during times when the community COVID load is relatively low. The realistic thing is that in time, the constant absenteeism of healthcare workers will drive them round full circle to having to require people to take some mitigations, because they're just getting smashed repeatedly with staff shortages because of COVID at the moment. And I agree with what Anne's saying there in the chat, is that, and this is why I'm trying not to say you should be marching in there and demanding your rights, because when you're sick, you don't march anywhere. You know, you're lucky to be dragged to the car by somebody who cares about you, and not everybody has someone who can do that for them. And you know, it's a complex system, as you say there, with the health insurers and so on. In the private sector, that's a different issue altogether, and they're very, very money focused. And so, as are the public hospitals these days, everything's about money. And part of the COVID experience for the private insurers was the amount of money they saved. And the thing they were very worried about for the cancellation of elective surgery, the thing they were most worried about was that people would decide that their health insurance wasn't very good value because they weren't able to use it. So maybe advocacy to the insurers in the direction of for unwell people, you know, is it worth having private health insurance if we can't even go to facilities because they're not going to protect us?
Lots of really practical suggestions there, Andrew. One of the comments that you made was in relation to data and how poorly served we are, I think, generally as a community at the moment in terms of what data is collected or available. And again, for example, in discussion with some officials about the low vaccination rates in aged care, when I was told, well, that's because people are refusing to have the vaccine, I was like, okay, so what information are you basing that on? Or we're hearing that from the facilities. It strikes me that with something that is so still very much in flux, as a lay person, it feels that so much is still in flux, so much is still emerging, and yet we've got very limited information on which to make solid decisions about public health measures. And so, for example, as has been put in one of the comments, I think that obviously we've moved from it being an emergency phase into an established health concern. But with the variants changing so very regularly, we could perhaps, I guess, find ourselves back at having a variant which has worse health outcomes or really evades a vaccine, which means that we needed the people in the community to step up the self-protection. Do you have any thoughts in terms of, because I agree with you, what you said at the start, is that the sense I have from my stance in the system is the public health response at the moment is, well, we're trying, but, you know, people aren't really interested. I guess I'm interested to know what strategies do we think will be needed to engage the public, either to get protection behaviour happening now, or more into the future if there is a more serious or a more acute variant that comes up? How can we engage the public, I guess?
Well, I think the answer to that is that there's a sort of encouraging part of it in that the community is very willing, and displayed that it was very willing to do whatever is asked of it in a time of crisis. So there was no serious resistance to vaccination when it was made clear to people, listen, this is what we expect. And then there were some mandates around jobs and so on, but that was only really required to get the vaccination rate from like 92% to 96%. The vast majority of people were very happy to put on a mask to go to the local shops. They were very happy to stay at home for brief periods of time when asked to do so. The trouble is that you need the government to be convinced, and that's why a lot of our advocacy has to be focused in that direction. And it's very difficult to match the big money lobbyists when it comes to government who want to see business continuing. Now, in WA, of course, the workforces that run the primary industries on the mines and the oil and gas and so on are very precious to the national economy, and they will be protected. So that's probably your way in through advocacy, is to say that if we want to keep this iron ore, being loaded onto ships and sent off somewhere else, and you may or may not agree with that depending on your stance on other issues. But if you want to make an argument to a government about health, it's the health of the workforce that drives that, and being able to keep that the integrity of the economy ticking over is generally the way in. And it's very clear from all of the data that we have from around the world that the places that had the lowest amount of community transmission had the best economic outcomes. If you can keep people working, keep people consuming, then your economy does better. And that is all related to people's health, people's view on how the consumer confidence is also affected by that. So we think making a sophisticated argument, and OzSage has drawn on the argument of economists to do this, and dispelling the myths then that are sort of tend to become, oft repeated in the media. As soon as you can find a doctor talking head who will say, oh, look, the pandemic's all over now. It's just like a common cold. We need to just get back to normal. And anyone who says that we don't is, hysterical. They're very popular views with certain elements of the media who want to push that from the point of view that they think that it helps their sales of advertising. And so those are the things we have to counter. But if we need to get people to turn out to vaccinate again, then it's going to require effective advocacy to government, to health authorities, and it'll be the Andy Robertsons of the world. But there's even a pecking order amongst them, because he will say that, in fact, he doesn't determine vaccine policy, that's determined by ATAGI, which is a federal organisation. So then it becomes quite opaque, because having any kind of, political influence at that level, at a federal level, is quite difficult.
And so then related to that is that sense then, and this is going back to a comment that I saw earlier about helping people, really a public health initiative that might help people understand how vaccines work, if you like, and people's own immune systems. So despite, for example, vaccines being the primary course of defence, that the general public need to be more informed to the fact that a vaccine isn't bulletproof, and so therefore they will still need to take some supplementary measures to mitigate their risks of acquiring COVID. What's your sense in terms of community awareness about that, or community openness to that kind of message?
I think the community is quite open to it. I think the awareness is negligible in terms of even airborne transmission and the need for clean air inside rooms and how stagnant they can be. The most dangerous places in our community are probably buses with closed windows on hot days or cold days, and Ubers or taxis with the recycled air conditioning switched on, because you'll very rapidly increase the amount of shared recycled air within that space. And so I think there's a lot of positive gains to be made in talking to people about, look, you don't drink grey water, you don't drink toilet water. Why are you breathing whatever the sort of person in the line behind you at the supermarket is breathing out. It's disgusting, and it keeps you so much healthier from so many other things as well. So I think Sam's made the comment there that there's a chance of a catastrophic variant coming about, and if that happens, we'll see some very, quick and serious action, I think, from government authorities. But if we don't see, and hopefully we won't see one of those, but we see just ongoing disability, that's a harder thing to get them to act on, as it is with obesity, as it is with diabetes, as it is with dementia and hypertension, all these things. Very hard to get regulation of sugary drinks and of high fat foods, because these are big industries with big influence. And
it's a really sorry, go on.
Well, I wasn't going to say anything important, but I just I don't want people to become discouraged, because we can. I think the other thing that has really is different now compared to AIDS, for example, and certainly Spanish flu, is the interconnectedness, the sophistication, and the ability to meet remotely. So a meeting like this, to have this number of people on a Monday afternoon, would have previously been impossible to get these kind of views out there as quickly and find the people that you want to follow. So part of what we do at OzSage, and part of us developing our new website is really very much which are the voices we should be amplifying. Who are the experts we can rely on? And we all have a bit of a sense of that now, but it can still be a bit confusing as to where to go to for resource. And getting the numbers together in a community that can speak to politicians, because they're scared of numbers. They're scared of opinions. They're scared of numbers. Our opinion as to whether they're doing a good job is the only important thing to them, not whether they are doing a good job. That might be what a lot of them got into politics for in the first place. But, I'm very disappointed in the current government's approach, that they didn't pivot when they had the chance after Mr. Morrison lost the lodge, and they had a chance to really do something, intergenerational to improve the lot for disabled people, and people who are those most affected by poor healthcare outcomes. And I think they're a little bit lost after you referred to the loss of the referendum. I think they're a government that's lost its confidence for bold reform at the moment.
Yeah, and yeah, to go back to your point too about like not losing heart. I guess one of the things in the early days of the response to COVID was actually people will take drastic action for public health measures, and I think the rapid change that we saw, many of those things, and again, it's about how we step up, if you like, the urgency, or how we make the urgency of some health issues become more apparent to people, where it's not as acute as, as we saw in those early days of the imagery from elsewhere. But continually, how do we keep telling the stories about how those ongoing disabilities or those chronic conditions and how they're affecting people on a day-to-day basis, and the urgency it has for those individuals. I've got one last question that was in the chat for me, and then we'll sort of round out with a kind of like advocacy checklist, if you like. We understand that in the US, they're talking about removing any isolation recommendations at all. Wondered if you had any comments on that, and what you think about that with regards to here in Australia.
Yes, look, it's completely ridiculous to remove any advice about isolation. I think it's a political thing, and it's an indication that this disease really is exceptional, because we don't treat any other infectious disease like this. If someone has tuberculosis or golden staph or whatever, we take special measures to isolate them from other patients in hospitals and make sure they're not spreading it. So there's no medical science basis to that. That must be purely a political thing. And I think that listing policy items and judging them as to whether they're based on medical science or they're not is a useful thing, because it takes away any cover that they can hide from. Now they'll say, well, we took medical advice, but they won't be able to say that they followed it, because no one can realistically say that lacking all isolation is effective for preventing the spread, and nor can it in any way be considered equitable for the groups that we know are more vulnerable to severe acute disease and long COVID.
Mm. That's a really helpful lens, I think, just that, is being able to apply, is this based on medical science or not? And like you say, when you put it so very clearly, no other infectious disease would be treated like that. So that's really very, very clear.
No, and hospital-acquired infection, therefore, is one of the drums that we beat very loudly, because for no other hospital-acquired infection are we so relaxed. We would be, if I have an IV in a patient that gets an infection in it, there has to be incident reports filled out, and people will come to check my antiseptic technique. But if I go to work with mildish symptoms and continue working and infect several people with COVID, no one will raise an eyebrow.
Yeah. It's hard to get your head around when you put it like that.
Well, it is, but then it comes back to my point that I made at the start: we're exactly where I expected we would be, because this is an unprecedented problem. So we're going to see unprecedented, ridiculous behaviour. Yeah.
So I just want to go through the issues that I've heard you talk about, in terms of that people can be both advocating for from themselves and also collectively. So us as an organisation, or us as a collective. Free or low-cost access to RATs, increased access and more prompt access to antivirals, the use of masks and respirators, staying isolated when sick and maintaining those requirements, access to vaccinations for, like you said before, I think anyone who wants them, so who may consider themselves to be at higher risk, stronger advocacy around air quality in certainly public spaces, but in all spaces, and that advocacy around safe access to healthcare. Is there any kind of those advocacy? Is there anything else on the advocacy list that I've missed, or?
I think I don't think you've missed anything, but just in terms of the vaccination, I think just highlighting the difference between the medical approach in the US and the political approach in Australia, and why it is that we think it's okay to use our kids as a bit of an experiment.
Yeah. And then I guess then to sort of round off, I think this is a question that's in the chat that sort of sums up, if you like, the challenges that many of us who might be talking to our friends and family in the community, or colleagues, or not here, I would say, but in other workplaces. How do we combat misinformation and encourage accurate information dissemination? When you're faced with somebody who says, oh, well, COVID's not that serious, or I've heard that the vaccines are really bad for you. What advice would you have for people in terms of a source of truth, or how people can combat this misinformation that they're experiencing in the community?
Yeah, it's difficult, particularly, and I think, again, choose your battles. So firstly, the people not to argue with, ironically, I think, are anonymous people on the internet and those closest to you. Those are the toughest those are the two groups that I say think twice before arguing with them, because the people on the internet often aren't people anyway. They're AI bots that are out there just mucking things up. So it's not worth it. But in terms of the people who are closest to you, it does require a patient and longer term approach, because I know that it can put a great deal of stress on relationships between parents and children, and even between partners, if they take an unscientific view on these things. So I think it's a little bit like when you're dealing with teenage children, just remembering that people might seem like they are ignoring you, but actually, where there's an area of difference, people will acutely be conscious of things that you say. So putting things in a respectful and gentle manner and saying, hey, look, I appreciate you don't agree with me, but the medical science is pretty strong on this. I trust people like Ryan McIntyre. I trust people from the Burnett Institute and so on. And I just trust the precautionary approach here. So that's what I'm going to be sticking with. And I don't want this to be, the thing that's going to, cause ongoing conflict between us. So it doesn't need to disrupt your lives. There just needs to be some protection around. And I think pointing them in the direction of things like the OzSage website, which has some pretty reasoned comments on it. There's a new COVID Safety for Schools link on there, which is an excellent course with a lot of good interviews in it, including Professor Jeremy Nicholson, who I referred to earlier, just explaining the basics of why this is not the flu, and why, you know, in the end, nobody really cares about us as individuals. They care about their own thing going on. And so I think that gentle approach, that longer term approach is the way to deal with it.
Yeah, Andrew, those are very wise words, and thank you. I know personally I'm going to take away that sentence that you said is I'm going to trust the precautionary approach. I think to me that seems something that would be difficult to argue with as somebody, if somebody was in my network. You know, it's hard to criticize me for wanting to stay to be cautious. Look, Andrew, we've reached our time. I guess I just wanted to take a moment, as has come up, and I have seen some of the chats as they've come up, but I haven't seen them all, but I will look at them after. I guess I did just want to acknowledge the loss and the impact that COVID has had for many in the community and continues to have, as well as the feeling of distress that many people in the community have with the challenge it can be of getting access to clear, concise, evidence-based information to know how to protect yourself and others. And I guess I would just like to say a huge thank you, Andrew, to you and everyone at OzSage. You're certainly one of the places that we turn to when we're looking to both look for information, but also how to make some of the information that might be available through the official government sources just a little bit more accessible for those of us who don't have a master's in public health, for example. But I wonder if everyone on the Zoom could join me in thanking Andrew in the traditional way. Thank you, Andrew, for your leadership through the whole of the pandemic and your time today. Thank you very much.
Well, thank you very much too for all your advocacy work and for building community, because it is by building community we can start to fix these things. And I think we stick together, keep communicating, keep having great discussions like the one today. And I think you've summarised our advocacy points really well. And thank you for your time. And those of us at OzSage are very committed to this. We will never give up on. I think our privileged eyes have been open to a lot of other problems that perhaps we should have noticed more along the way that have been highlighted through the pandemic. So thank you for the conversation.
Thank you very much. Bye, everyone.
Cheers.